So basically today we're gonna start another important neuralgia which is was herpetic neuralgia. Let's start it with Bismillah Rahman Rahim. So the patient will come with the history of the herpes zoster. Means the patient has suffered from shingles in its past. Okay, very important. Then 10% of patient has herpes infecting the trigeminal nerve, and basically there is a reactivation of the virus which was in its latent stage with the Varicella zoster. Ophthalmic division of trigeminal is affected basically, and the reactivation occurs once in life, but 5% having two attacks. T cell immunosuppression occur in this. Pain mostly occurs at an attack of facial herpes zoster. There's a burning, dull, boring type of pain in the area of eruption before 2 days of the up to 2 days before the vesicles appear. The pain is actually associated with herpes subsided within week. Some patients neurologic pain is for months to years. Okay, then there's a pain intense with accompanied by stabbing sensation, means that you feel like someone has moved it through the knife. Hyperalgia means you have basically an sensation of pain. Paresthesia is numbness, and allodynia is basically the pain. If a patient is touched for even a second, he will have a painful experience. The distribution of pain follows the original infection. Pain are more valuable and severe than trigeminal neuralgia. So they are saying the pain is actually more severe than trigeminal neuralgia. The skin is red. Patient may have scratches at the skin to gain relief. Means to relieve he make it continuous scratching. So suicidal depression, basically possible deliberate self harm. Basically older patients with herpes are susceptible to post-herpetic neuralgia over at the age of 60. Mean the uncommon under the age of 50 risks more in patients having more pain, having severe pain and rash during the acute phase. Means they are saying there is a risk more in patient having severe pain and rash during the acute phases. Now treatment, you give antidepressants to the patient. Gabapentin you give in antiviral drug, you give acyclovir. Then you can give transcutaneous electrical stimulation because to stimulate the nerve. Pain may precede, accompany and persist after the acute vascular phase of, means it can also be continued after even the acute phase of vesicular phase of herpes zoster. Pain persists after herpes zoster is called post-herpetic neuralgia, and the risk is increasing with age. So the pain actually continues even after herpes. So it is called, that's why a post-herpetic neuralgia. You can see this picture on one side. There are actually red rashes all over the back, but confined to the one side, not to cross the midline. Okay.